Should you treat your kid's stye at home or see an eye doctor? If you're Googling this right now with a grumpy child next to you, here's the short answer. Most styes can be managed at home, but there are 3 specific signs that means you should get it looked at today. So before you do anything else, I want you to ask yourself 3 questions about your child's eye. Question 1. Is their vision affected? Can they see clearly, or are they saying things look blurry? If the stye is affecting their vision, that's a sign to get it looked at rather than treating it at home. Question 2. Is the redness spreading, or do they have a fever? A stye is usually a localized bump. If the redness is spreading across the eyelid onto the face, or if your child has a temperature, that suggests the infection might be spreading beyond just the blocked gland. Question 3. Is the swelling near the inner corner of the eye close to the nose? This area is close to the tear duct and other structures. Swelling here can sometimes indicate something other than a simple stye. If you answered yes to any of those, I recommend getting your child seen by an optometrist or GP today rather than managing it at home. If you answer no to all 3, the bump is localized, vision's fine, no fever, no spreading redness, then you're likely dealing with a straightforward stye that you can treat at home. Let me explain what's actually going on. A stye is essentially a blocked oil gland in the eyelid that becomes inflamed or infected. Your eyelids have tiny glands called the meibomian glands that produce oil. This oil is part of your tear film. It helps stop your tears from evaporating too quickly. Sometimes these glands get blocked. When that happens, the oil builds up, the bacteria can get involved, and you end up with a red, sore bump on the eyelid. Styes can appear on the upper or lower lid. There's no real difference in how common they are between the two, and they're more frequent in kids, partly because kids tend to touch their eyes more and aren't always great about hand hygiene. Now, you might have heard the term chalazion as well. People sometimes use stye and chalazion interchangeably, and honestly, even in clinical setting, the distinction is very subtle. Generally speaking, a stye tends to be right on the lid margin near the lash line and is more painful and red. A chalazion is usually a bit further from the edge, might be less painful, and can hang around longer. But here's what matters for you as a parent. The initial treatment is the same for both. So let's talk about what to do. The cornerstone of treating a stye at home is the warm compress. This is the single most effective thing you can do. Here's how to do it properly. Get a microwavable heat pack. You can find these at the chemist. Heat it up until it's warm but not hot. You should be able to hold it comfortably against your own skin without pulling away. Have your child close their eyes and place the heat pack over the affected eyelid for about 10 minutes. Do this at least twice a day. The warmth helps to melt the oil that's blocking the gland and encourages it to naturally drain. The more consistently you do this, the faster the stye will resolve. If your child can tolerate more frequent sessions, that's even better. Some families do it 3 or even 4 times a day, and that can really speed things up. The second part is lid hygiene. After the warm compress, you want to gently clean the eyelid. You can use plain water, or if you want something more thorough, there are eyelid wipes available at the chemist. I often recommend a product called OptiSoothe preservative-free wipes. They're gentle, use natural ingredients like tea tree oil, and are good for sensitive skin. Systane also make lid wipes that works well. The goal is to keep the area clean and reduce the bacterial load around the lash line. Now, what not to do? Do not squeeze the stye. I know it's tempting, it looks like a pimple and you want to pop it, but squeezing can push the infection deeper or spread bacteria to other parts of the eyelid. If the stye is going to drain, it will do so on its own with the help of the warm compresses. Let it happen naturally. In terms of what to expect over the coming days, most styes will start to improve within a week or 2 of consistent warm compress treatment. Some resolve even faster. It's not uncommon for a stye to look a little worse before it gets better. It might swell up, a bit more in the first few days as the contents come to a head. That's normal. Keep going with the compresses. If you're at the 2 to 4 weeks mark and it's not improving, or if it's getting worse, that's when you should book an appointment. Now, let's talk about the situations where home treatment isn't enough. This relates to those 3 questions I asked at the start of the video. But let's go over a few more of the red flags that mean you should get it checked. If your child's vision is affected, if they're saying things looks blurry, or they're having trouble seeing clearly, that's a sign to get it looked at. The same goes if the redness is spreading beyond the bump itself, across the eyelid or onto the cheek, or if your child has a fever. Pain is another indicator. A stye is generally tender, but if it's very painful, more than what you expect from a small bump, that warrants attention. And then there's the time lag. As I mentioned earlier, if it's been more than 4 weeks and it's not improving despite consistent warm compresses, or if the stye keeps coming back, that's when you should book an appointment. Recurrent stye can sometimes indicate an underlying issue with lip hygiene or inflammation that needs to be addressed. In most cases, even when you come into the clinic, we'll still recommend continuing with warm compresses, but we might add a few things. If there's a significant infection, we might recommend you to see a GP for oral antibiotics. These work systemically to help clear the infection from the inside. One thing I should mention, antibiotic eye drops that you apply to the eye generally don't help much with styes. The infection is inside the gland, not on the surface. So even though pharmacists or even GPs sometimes recommend these antibiotic eye drops, they're not particularly effective for this situation. For very stubborn styes that won't resolve, there are other options. Some clinics do offer low-level light therapy, which can help open up the blocked glands. And in persistent cases, an ophthalmologist can perform a small procedure to drain the stye. This is called incision and curettage. It sounds more dramatic than it is, but it's usually reserved for styes that just won't budge after months of conservative treatment. But let's say your child's stye does clear up. What then? If your child have had one stye, there's a reasonable chance they might get another one at some point. Some kids are just prone to them. But there are things you can do to reduce the likelihood. Hand hygiene is number 1. Kids touch their eye constantly. They rub them when they're tired. They touch them when they're playing. They don't think twice about it. Encouraging regular hand washing, especially before touching the face, can really make a difference. Keep the eyelids clean. If your child has had recurrent styes, it might be worth incorporating lip hygiene into their regular routine. A gentle wipe along the lash line a few times a week can help keep the oil glands clear and reduce the bacterial buildup. Those OptiSoothe or Stay wipes I mentioned earlier are good for this. It only takes a few seconds and can prevent a lot of hassle down the line. Watch for eye rubbing. If your child rubs their eyes a lot, try to figure out why. Are they tired? Do they have allergies? Is the air dry? Kids with hay fever or allergies often rub their eyes because they're itchy. That rubbing can introduce bacteria and contribute to blocked glands. Managing the underlying allergies can help reduce eye rubbing. Change pillowcases regularly. This is an easy one. Pillowcases collect oil, bacteria, and dead skin cells. If your child is prone to styes, changing their pillowcase more frequently can help. Don't share towels. If one child in the family has a stye, make sure they're using their own towel and not sharing with siblings. Styes are highly contagious, but it's good practice to avoid cross-contamination. Now, while we're talking about your child's eye health, what they eat every day can actually make a measurable difference. In this next video, I'm going to show you 3 specific foods that research shows can help protect your child's eye. And if you found this helpful and want to connect with other parents navigating their kids' eye health, I've got a community called Healthy Kids Community, where we talk about your kids' eye health, and the link is in the description. And if you're here in Perth and you want to get your child's stye checked out, you can also book a consultation at my clinic, the Myopia Care Clinic. The link for that is in the description as well. See you around. Bye-bye.